Hello, my name is Allison Littleford, and I'm a current BSN to DNP student at Pittsburg State University. And I'm going to talk to you guys about an interview I did with a coworker at Jane Phillips ER in Bartlesville. And we'll just get started telling you about his background. He did his undergrad at Oral Roberts University and worked as an RN for 8 years before graduating as a family nurse practitioner. And he went to the University of Oklahoma to obtain his advanced nursing practice degree. So he started off at St. John's Surgical Unit, and he spent 4 years working there in their surgical ICU. Then he moved on to house supervisor, float pool at St. John's in Tulsa, working the night shift. And then the last 2 years when he was a full-time student at the University of Oklahoma doing his nurse practitioner, he worked in a surgical recovery unit again on the night shift. So he spent 8 years total before graduating, and then started his career off at St. John's ER in Tulsa, which was a level 1 trauma unit. So talking to him, he said he really enjoyed the surgical ICU, and then it was easier for him to kind of kept up on his homework, working night shift surgical recovery. It was less demanding than some of the other roles that he had had. And interestingly enough, while I did this interview, we were talking about starting IVs and different things that maybe they asked the nurse practitioners to do at either job that he's had as a family nurse practitioner. And he said, honestly, he hadn't even started that many IVs because he had worked in higher acuity settings, and all of his patients either had central lines or PICC lines. So he thought it was interesting that so many of the nurses at both facilities have said, hey, do you think you come in here and take a look at this? Do you think you can have better luck than me? And he's never even done an EJ. So he thought that was interesting that the nurses asked him to do that. And of course, we don't ask our physicians to start IVs because they've never really had to. So that was just one of the interesting things he talked about in his prior setting compared to working in an ER that he didn't really get much chance to do. He said maybe 20, 30 IV starts in his career. So I thought that was interesting. His current job is at Jane Phillips ER, and he works in a couple different settings in our ER. We have a main side that has 16 beds, and that's where we put most of our level 1, 2, and 3 triage patients. And then there's what we call our urgent care that's open from the hours of 11 a.m. To 2300, and that's where we put our advanced nurse practitioners. And then we have one physician that works over on that side quite a bit, and then the rest just kind of fill in to keep that covered. And that's where he works probably 2/3 of his shifts is on the fast track side. So there they see level 4s and level 5s. So the main job that he's doing on our fast track side is seeing maybe people who need sutures. They may have a fractured bone, and he's going to do the casting or splinting, or maybe putting in an immobilizer or boot, and consulting with our orthopedics. Or that's where we put a lot of our coughs, our sore throats, earaches, stuff that require less resources. And then on the other side of that, he works on the main side of the ER. And being in Oklahoma, he can't practice without having a physician on site with him because they're limited practice. So he can't work our 0600 to 1600 shift because the provider is by themselves for 3 hours in the morning. So he will work on the main side when there is a MD or DO present, and those shifts are from 9 o'clock is when they would come on, and then they come off at 8 o'clock p.m., so 2000, and they also have a shift that starts at 1600 and ends at 0200. So if he's working on the main side, it's going to be between those hours with another provider. So he said that he really kind of likes the change of pace where he's going back and forth between the urgent care setting, where they're seeing the lesser acuity, less resources needed, and then the main side where he has somebody where he can go to and kind of bounce some ideas off of, and has somebody there to kind of help him out between those hours if he feels overwhelmed, or if it's something he's never had seen before. Where at St. John's, his prior job, he was seeing that all the time and working any shift because they always have a provider there, and there's never just one provider at the bigger facility. So he learned about the current job because he worked at the St. John's facility, and he's been within the St. John network since he graduated from nursing school as a registered nurse, and immediately started at the hospital setting for St. John's and switched from their main ER to the clinical setting. After about a year and a half, he went to them and said, hey, I think I would like the clinical setting better. And they came back to him and said, we have a really high need for nurse practitioners at St. John's / Jane Phillips ER. Would you be interested? Which it's about a 45-minute to an hour drive. But he liked the idea of the variety, and he said, I think that would be a good fit. So after a year and a half at a very busy ER, he switched to Jane Phillips, which is still busy, but a little bit different since we're not a trauma center. So again, he learned about that job from his initial interview and his contacts with them, and going back to him and saying, I'd kind of like a change of pace, and they thought he would be a good fit for this job. So I kind of went over the hours that he works, but the duties, like he said, he does a lot of suturing, he does INDs, he does admissions to our main hospital, outpatient, inpatient. He works with our hospitalists. He also works with our specialists like ENT, our pediatricians, and also our orthopedics, or most of the consults that they do at our ER. Also, the family practice that have practices where they're allowed to admitting privileges at our hospital, he also works with them. So he works with a variety of family practice to hospitalists, internal medicine, and also like I said, the pediatricians, which we don't do a ton of pediatric admissions, but they do still consult pediatricians, especially if they have a set provider, they'll call and kind of check in with them. The next thing that we talked about was the benefits and pay of his job. So he was very straightforward, didn't mind answering the questions at all. So he said that they get $2,000 of cash towards CEUs every single year. He gets 94 hours of paid time off each calendar year, and he gets paid $60 an hour. So something we talked about while I was interviewing him was he was scheduled for 5 shifts this week in a row, and he was scheduled 5 12s because they were short on our main side, which is sometimes 8 or 10 hours. And then in Fast Track, they didn't have enough providers, so they scheduled him for 5 shifts this week. So he worked 5 12s, so I knew he was going to be hitting overtime, and I asked him what the overtime benefits were, and he said they don't pay him overtime. It's not written in his contract, which I didn't even know was possible, so it didn't seem to bother him. And he said that while he's not working in Jane Phillips ER, he does pick up in the St. John clinics in the surrounding communities, which they have clinics in Owasso, Independence, Coffeyville, Tulsa. So he is able to pick up a lot of different areas within the Oklahoma state lines. He also said that he shopped around, talked with his wife and a few other friends before signing the contract, and his contract pay and benefits didn't really change switching from St. John's main hospital in Tulsa to St. John's Jane Phillips in Bartlesville. When talking with him about a mentor, he said that his biggest mentor has been his wife. They've been married for 9 years, and she's been an NP for 5 years. So he didn't go back to school until she was finished with her advanced practice, and they have the same degree and they went to the same school. But he said that she's really been his sounding board and the person he went to with questions, schooling, what was the best decision for him and where he wanted to go and how he wanted to go about going to school, and that when he has questions about his job or when he was thinking about switching his job, he really felt like she was the best resource and mentor that he had, because obviously they have a close relationship and she understands. So he said that's been the best mentor or leadership or helper in his role as a nurse practitioner, the person he goes to the most. And we already discussed how he kind of found this current job. He just felt like he could go back to his original contact people and tell them that he felt like he needed something that was a better fit for him, and it worked out well for him. And again, he's been under the St. John umbrella of employment since he started out as a nurse. When he talked about things that had changed the most in like laws and legislature since he started as a nurse practitioner, he felt like the one that came to the top of his mind was narcotic suspension. And in Oklahoma, they nurse practitioners used to be able to write for Norco, and that changed about a year ago maybe a little bit longer, and he said he felt like that was the biggest change, and he knew when he was about to graduate that it was in the works to change, but that was the biggest changer, was the schedule of medications and what they could write for. And since I had just done the recent assignment about current legislature in Kansas and Oklahoma, we talked a little bit about how much he keeps up with it. And he admitted that he really hasn't followed closely because he doesn't mind the limited practice setting in Oklahoma. He's happy. He's got a lot of options because he lives in a metropolitan area, Tulsa, just outside of Tulsa. So he doesn't really feel like he's limited at all on not being able to have a open practice or full practice. And it was just interesting to me that he hadn't even really thought that much about it. And of course, we've been learning a lot about it in class. And Kansas just seems to have a lot more rural area than where he's at in Oklahoma. So it doesn't really affect him, and he hadn't kept up with that part of being a nurse practitioner. Something else that we talked about is his daughter just verbally committed to a college in Oregon, and him and his wife had been discussing whether or not they would be interested in moving there and changing practices and what that would be like moving there. And so we were able to get on the interactive map that I told them about from previous assignments, and we looked at Oregon, and Oregon is a full practice state, so both him and his wife would have a little bit more choices if they moved there, and they could, if they so decided, to have full practice. So that was something interesting that we talked about and looked at together just from doing this interview. And he said, well, I have to go home and talk to my wife about this tonight. So he talked about his relationship that he's had with all the physicians that he's worked with, and he felt like he has a really good working relationship, and he hasn't had too many bad experiences with other physicians not respecting the nurse practitioner. I had to remind him of a specific instance that it was my patient, and he was my provider, and we had a pediatric 7-week-old child or infant that had been diagnosed with pneumonia. And when he went to call the pediatrician, she wouldn't speak to him. She said, let me speak to the physician on site right now. And she's kind of known for not wanting to speak to any type of nurse practitioner, or mid-levels as she likes to call them. And he said, I had kind of forgotten about that, but it was silly because he had to hand the phone over to the physician that was working with him that day in the ER. And so what happens is the Dr. Hay is asking questions and saying, hold on, and asking Bo, the provider who has seen the patient, assess them, looked at all lab values, and then repeating the answers to the physician. So I thought that was funny that particular pediatrician won't even speak to nurse practitioners, and just kind of very offstandish. And he said that's the only one that I really had trouble with. And I thought that was nice that out of all the encounters he's had with hospitalists and surgeons, general surgeons, and transferring, that the only time he could really recall somebody not respecting our practice was that particular pediatrician. So I was glad to hear that he hasn't had too many bad experiences. One problem that he said he's encountered with a lot of the providers in Jane Phillips compared to St. John's in Tulsa is admission rates, and it's a lot harder to get physicians to accept under even the similar lab values or circumstances or illness. They don't want to accept in Jane Phillips, but they do more easily and freely at St. John's in Tulsa. So I thought that was interesting as well. The last bit of advice he had for me was to love what you're going to do and really pick a job that you love and that you feel like you can be happy in, and not just about the money. That you should pick something that you think you can be happy and have a good effect on your patients, and there's a lot of options, so don't sell yourself short. And he definitely said that shop around and market yourself, and even if it's hard for you, that you shouldn't take the first offer that you get, and you should go back, because we talked a little bit about that. And I think that marketing yourself and going back and saying, no, I'm worth more than that, is kind of hard. And he said his wife thought the same thing, and she was very influential in encouraging him to go back for more, and really work with the people on what you accept. So thank you for your time, and hope you enjoyed this interview recap.